Hello, everyone. Bienvenidos a todos and welcome. Tonight is a very important town hall, COVID-19 in our Latinx community. Now, at the height of the pandemic, we held a town hall similar to this one, where we talked about COVID-19 and the impact that it was having on the brown community, the communities of color. Well, now we have seen those numbers shift, and we are noticing that Hispanics and Latinos are being affected more than any other race, not just in the nation, but also here in our backyard in Houston, and that's a problem. On Monday, Houston Mayor Sylvester Turner mentioned that the 6 deaths that were being reported that day, all of them were Latinos. So, of course, we can see this is a big issue, and I'm very passionate about this myself, and that's because I've had relatives on my side of the family and my husband's side of the family greatly affected by COVID-19. And tonight we will be answering some viewer questions as well as talking about what we can do, what we can really do, and hopefully find solutions tonight for the underserved community. Of course, I want to welcome everybody and want to congratulate our panelists for being here and taking a big step in helping the community. So I want to introduce them now. Dr. Joseph Varon, Chief Medical Officer at United Memorial Medical Center. Congresswoman Sylvia Garcia of Texas 29th Congressional District. Sheriff Ed Gonzalez with Harris County Sheriff's Office. State Rep Armando Wally with Harris County COVID-19 Recovery Czar. Dr. Laura Murillo, President of the Houston Hispanic Chamber of Commerce, and also Susie R. Molina, member of Mayor Turner's Hispanic Advisory Board. Thank you so much, all of you, for being here tonight to talk about this. Well, the first question of the night will go to Dr. Varon. So as I mentioned already, Doctor, at the start of the pandemic, we saw Black and brown communities affected in almost the same level, but now we're seeing that shift. So on Monday, I reported that of the city's 478 deaths, Hispanics made up almost half of those deaths. Very alarming. So Dr. Varon, why do you think that we're seeing this shift in those numbers happening now?
And you are perfectly correct, Myra. What we saw is, let's say in the month of April, I was seeing 80% of what I had in the hospital was African American, 15% Hispanic. In May, we had a huge shift, and I attributed it to a lot of factors. Number one was Mother's Day. And I know it sounds a little crazy, but, I beg people, please don't go and see the grandmother, the abuelita, or the mother, or things like that. But literally, within 10 days of Mother's Day, my number of admissions shifted dramatically to the point that I had 80% of my admissions were Latin people as compared to the previous month. Then we had, the Memorial Day weekend, and a lot of Hispanics went out. Why? Because Hispanics were very warm people. We like to hug. We like to, when we say hi, we give you a kiss. And more importantly, we're very family oriented. So the weekends, you go with the families. There is a big celebration. If you go to the beach, you don't go alone. You bring everybody with you. So I think that that's the reason why we have it. Yes, we're talking about a community that may have some issues in accessing healthcare. There is no question about it. And in fact, what I have seen the last few weeks is that those Hispanics that come to the hospital come in very sick because they waited. And they waited because among Hispanics, going to the hospital right now means I am going to the hospital to get COVID. Simple as that. Or I am going to the hospital to die. So there is a big reluctance among the community to go to the hospital.
Yeah, I bring up very good points there. Now, Congresswoman Garcia, I want you to weigh in on this here. What are you seeing in your district?
Well, it's similar to what the doctor is suggesting. And first of all, thank you for inviting us and having this really important discussion, because it's a discussion that doesn't need to just be held here in Houston, but in Texas, in fact, the nation, because nationally, 1 out of every 5 who have died from COVID has been Latino. And in Texas, although we're only 40% of the population, we're almost half the deaths being recorded now. And even in my own district, where 4 out of 5 people are Latino. Every zip code in my district had a 30% plus positivity rate. That is really, really high. So I think it's a question of making sure that we have the resources, the testing, the tracing, the ability to get masks in these pockets that are really, really being impacted the most. And that's something that we saw from the very beginning. The very first map that the Houston Chronicle reported on where the hotspots may be, where the vulnerable populations were, was not where they put the testing sites. So we've been working really hard in Congress to make sure that we give the local governments the dollars that they need to improve testing, to improve tracing, to beef up what they're doing, to provide the PPPs, to make sure that everyone can have access to the resources. It's really easy for most of us to say, wear your mask, but there's still a lot of people who don't even know where to get a mask. I was at a CVS recently. I was wearing my mask, and someone actually stopped me and said, where did you get that? Where did you get that? You know, so we got to make sure that we put the resources there, and that's why for us in Congress, you know, we passed the HEROES Act 3 months ago, and the Senate still has not acted. It's still being debated. It's still being negotiated. It's time for action, but it's time for action to make sure that we reach all the vulnerable communities. And unfortunately, in my district and in Houston, there are many, and across the state, there are many.
Yeah, I guess it seems like a matter of like having more of these mass mask distributions so that you won't have those people saying, hey, where did you get that mask, right?
Well, you know, I've actually considered, and I'm still trying to figure out a way to do it, of just mailing everybody a mask, because they fit, those disposable ones fit in an envelope, and just saying, here's your mask, here's instructions to make one at home if you want to, and if not, call us so that we can tell you. We're distributing about 50,000 masks that I got N95s, and they were meant for this purpose. To reach the clinics that serve the Latino population. So we're delivering them this week and next week to make sure that all the FQHCs, the health centers, and all the clinics in my district have those. Regrettably, it's just my district, and I'm working on a project to try to get the dollars to make sure that we can do that county-wide, because I know what I'm doing in my district, but I'm not sure who else is doing what in their districts. Next week, I get another 20,000, and those will be the disposable ones, and those are the ones that I'm considering putting in an envelope and mailing. And we'll also be going to where people still go, to the grocery store, the pharmacy, the post office, the filling station, and, of course, Home Depot. So we're going to have to do that because, you know, we tell people there's drive-through testing, but guess what? We don't have access to transportation. They may not have a car. If they have a car, they may not have money for gas. So we can't expect people to figure out where to go if they don't have a way to get there. So we have to go to them. So I think we need to ratchet up a notch, put all hands on deck, and do everything we can, because people are dying. People are dying. Imagine, you know, and it's impacting children, this whole notion that this president has, that children are basically immune, is just false. Children have been tested here. 9,800 kids in Harris County have tested positive. And that's not even while they're in school. That's while they're at home. 85 infants in Corpus Christi were tested positive. They were all under 1. So we got to make sure that our schools are safe before we make all these kids go back to school, because those numbers are going to increase, and that's on us. So we've got to do more, and we got to do better.
Thank you, Congresswoman. Okay, so now I want to talk about 3 factors that we know are a big reason of why the community is being hit hard as well. Dr. Barone was touching on this earlier. So there's 3 of them. Number 1, many live in multi-generational homes. Number 2, many are essential workers. We know that. Number 3, many don't have health insurance, which can actually lead to poor health conditions. And I want to talk about all of them separately. That way we can really hone in on this. So the first one, of course, I want to touch on living in generational homes. Many people live together with the abuelitos, abuelitas, and then the older children. I know myself, I lived with my parents for a good while before I was able to leave. So I want to start with Susie Molina on this. Would you like to take the lead on this and just, talk to us about this? Is this sort of a problem in the age of COVID?
I think it does pose a problem because you have multi-generational families living in one house. A lot of times that's one bathroom for 5, 6, 7 people sometimes. So when you're trying to self-quarantine and you have a COVID patient that's within the family, it's very difficult to keep that person self-isolated because they all ultimately have to share the restroom. They have to share certain spaces. They may not have a full-time caretaker for that person. So it's difficult to conceptualize, how do I self-isolate when we're in very tight living quarters?
Yeah, that's really tough. And I know we've talked about it too, where you tell them wear your mask, but I guess sometimes, you're close to your family and you feel like sort of maybe a disrespect in a way, like wearing a mask around your parents. So I think there's also that notion of it.
Sure. Or they think, oh, let me quickly run in here in the room where, my cousin is and I need to get my phone charger. And let me just, it's a very quick thing you do. And that quick time can just really make an impact.
Yeah. Armando, while I want to get you in on this, any kind of solution to this? I mean, it's tough when you're talking about multi-generational families.
Yeah, I wouldn't say, first, thank you, Maida, for the opportunity to be on the show and really empowering our community, because I think this is a platform to empower our Latino community. But look, we live in, I grew up in a multi-generational household. I grew up with my grandparents for many, many years here in Northeast Houston and the Aldine area. And there's probably 3 families in that household. It was my grandparents. It was me, my mom, my younger 4 brothers and sisters, and my uncle and his wife in the other bedroom. So it was a small 3-bedroom home. My grandparents in one bedroom, my aunt and my uncle and his 2 kids in one middle bedroom, and we were on the tail end of the house. 4 or 5 of us in the other bedroom, and so it poses a huge risk for us. Look, we're family also that very loving, very cariñosos, and want to hug and be with our families, and that's part of who we are. And when the roles are switched, now my mom and her sister take care of my grandfather, who is 90 years old and he's on dialysis, and so they have to take him to dialysis 3 times a week, and so it's very, very difficult to practice social distancing when you're in those tight quarters, particularly even at 90 years old. My grandfather has his own room, but obviously we got to take him to dialysis. He has to be masked up. We have to use extreme caution in trying to take care of him because, look, let's be honest, we're very loving family. We're like many families. We're not going to send our abuelitos to the nursing home, and that's just part of who we are as a culture, part of who we are as people, and that loving, unfortunately, in this context, poses a slight danger. But we continue to have to look. We have to wear those masks. If anything, we have to wear those masks around our family members, because that mask doesn't protect you. That mask protects your loved ones or somebody close to you from contracting the disease or the virus. I'm sorry. And so that's one thing. Look, we must ramp up testing. And so I do want to get a plug in for those family members that are homebound that need testing. If you call 832-927-7575, that's or readyharris.org. If you have a computer, we know digital divide is a big problem, but call 832-927-7575 and inform those folks on the phone that you want to get tested at home. That way you don't have to go to a particular testing site. The city of Houston also has their own particular sites for testing. But look, we have to get testing. 832-927-7575 is the number that I want folks to remember, if anything from this program. But But yes, it is a difficult task to try to combat this disease when we have other social issues as well. Poverty plays a big role in contracting the virus, right? Because and many of our folks never stopped working. They were essential workers, construction workers. They never stopped working. Folks that worked in the energy industry never stopped working. So for many of our family members, yes, we're loving folks. But look, poverty plays a huge role, and a large percentage of our folks live in poverty. A large percentage of our community members are undocumented or immigrant families that fear going to the clinic, that fear going to the hospital, as Dr. Barón said, going at the last minute, because we know, according to the Kinder Institute at Rice, that a big hindrance for people getting health care is access to that health care is because so many of us live in poverty. But also the public charge. President Trump was attacking communities, particularly undocumented folks. The public charge issue is is making people stop them. They're not wanting to go to the hospital because they don't want to. They fear government, and so there's a lot of other social determinant issues that are actually contributing to the high rise of Latinos being impacted disproportionately by COVID-19.
Yeah, so many issues on hand for sure. And of course, you bring up a lot of great points too. The second factor, we know that a lot of Hispanics are essential workers. You were just mentioning that they're in the front lines working every day, putting themselves at risk. And sadly, we lost 2 Houston firefighters to COVID-19 recently. We know Captain Leroy Lucio had a long battle, as well as Gerardo Jerry Pacheco. And we really just want to send our condolences to their families because this is such a tough time. And, they really played a big role here in the city of Houston, keeping the city safe. Now, this question for Sheriff.
They don't have access to some of the ready resources that may be out there. And I know we've heard a lot about testing and go get testing, but I've heard anecdotally where some go to get tested and wait in their car. And unfortunately, there's long lines sometimes when there's a mass giveaway or free testing going on, and they have children in the car and no daycare and those type of challenges that occur. And that's a tremendous burden on the Latino community. We've heard as well that culturally, we like to be surrounded by family. The challenge is that there's also a lot of health disparities that exist in our community. A lot of type 2 diabetes. It's not always diagnosed. Some are walking around as we speak today that are undiagnosed, and yet their risk factors go up significantly. Obesity is another underlying factor that's out there. And so many as well, there's a cultural aspect that I think we can't ignore, that sometimes there is an element of machismo, for example, that, hey, I'm not going to go to the doctor. I could beat this. It's just a cold. It's just the flu. I'm okay. But it's not, because those underlying issues will get you. We've seen people very young that have passed away, as well as even seniors. And so there's a lot of different challenges that are, converging all at once. And so it's really upon all of us as a community, those that maybe hold leadership positions, as well as those that just can be advocates in our own families and our neighbors to really spread the message and tell them that it's much more than just wearing a mask. You also have to wash your hands on a regular basis. You also have to make sure that you're practicing social distancing as much as possible. We already talked how we tend to sometimes live in crowded conditions. Many of our community are not homeowners. They don't have the benefit of having multiple rooms available to spread out as well. And we're just so used to hugging, and everything is a barbecue, a carne asada, everything's a celebration. And many beautiful aspects of our culture is also a negative sometimes, especially in this situation. So we really have to continue to advocate the message that by staying apart, we come together as we fight to find a virus. And really, again, you asked specifically about the law enforcement and first responder community. Unfortunately, we don't have the benefit of truly working from home. Our correction staff has to be on hand as we provide care and custody for more than 8,000 individuals daily. By the way, there's a lot of disparities in the criminal justice system as well. 70% of our current jail population here in Harris County consists of Black and brown individuals. 70%, 50% are Black individuals, and 25% are Latinos. So there's a lot of disparities that go on in everyday society. COVID is just simply amplifying it. We're seeing a lot of elements of domestic violence as well from that cabin fever. So we're seeing a lot of incidents of that as well because people, again, are in tight quarters. There's conflict that goes on. And many obviously are having to now, come closer to their abusers sometimes. So there's just so many factors. That's why this conversation is so important. And hopefully this is just a start because the Latino community is really in the crosshairs of this very vicious disease because it really is a killer. If one thing doesn't get you, it's another thing. You may survive COVID, but you don't survive the heart attack that may come with it, the stroke that may come with it. There's so many other factors. This is scary, and we need to be raising the alarm every day.
Yeah, that's good. And I think with having this conversation, we're really realizing what we need to do to help the community. Now, Dr. Laura Murillo, as president of the Houston Hispanic Chamber of Commerce, you are one of the city's chief advocates for the economic and civic interest of the Hispanic businesses out there, the community as well. What are you hearing from your members about protecting those essential workers?
Thank you for having this conversation. I think many in our community may feel that it's okay now to be out at the stores. And we talked about masks, and before I get into the business aspect, it's even as simple as realizing that, okay, now the message on masks seems to be out there with our community. But I can't tell you how many times I have seen people with the mask around their chin. So now we have to say, cover your nose, cover your mask. And when we look at our families out in the stores, they take 6, 7 people with them. Early on, there was 1 or 2 people that were being allowed into these grocery stores and a lot more social distancing. So thank you for having this program as a reminder that it is not time to be casual about this. We must continue to educate, especially our community, in English and in Spanish. In Houston, Hispanics represent over 100,000 small businesses. Our chamber has partnered with the University of Houston, the School of Public Policy, to put together a survey. And some of the results that we've received from that are daunting. Absolutely just so sad to know that so many of our businesses have already, and at least 10% of them will never come back again. We also understand that the economic impact of Hispanics just here in Houston is a spend of over $54 billion. So as I like to say, as go Hispanics, so goes Houston. This is everyone's issue. And we need to make sure that this population that is 42% of this region is protected and has information. And we appreciate the hard work of all of our leadership from the local level to the state level and the federal level. Think of Houston. They put together money so that people could pay their rent. If you look at what the county has done, they've recently also provided relief funds. All of that money is gone. It's come out, people are applying, and it's gone. When you look at what came through PPP, unfortunately, so much of that money, a lot of our businesses didn't apply, Myra, because they did not either understand the process, did not have access to a banker, did not have a lawyer or accountant to help them apply for these funds. The city and the county have done a great job of trying to simplify this process, but we are in the middle of a horrific storm. We must protect people. Having these conversations in English and Spanish on a regular basis need to continue to happen. We are still suffering. People must understand they can die. This is something that can kill you. Let us continue to talk about this.
Yeah, and you mentioned a lot of these mom and pop Hispanic businesses, like you said, they started on their own. And you're right, they don't have that go-to lawyer, go-to accountant, so they lose out on getting that money, the help, because they just don't know what to do, and their business unfortunately fails.
Yes, and then they have the pressure now of sanitizers, plexiglass, all of these things that they need. Recently, Houston First has put out a Houston Cleanliness program that's going to be by a lot of businesses. But guess what? Once again, Hispanic-owned businesses are going to be at the bottom of that opportunity because they lack resources. They lack the financial resources. And people say, well, stay at home, stay at home. Guess what? That's not our people. Our folks are out there making sure that we, the rest of this community in this country, that we have food that we can put on our table. We must protect those who have the least and don't have a voice and don't have the luxury to work from home. The children that we're trying to get back into schools. And so that's why every day our chamber is working to advocate, to provide information and resources in English and Spanish about the many programs that are out there. And to all of our elected officials who are putting their lives on the line. They have children too. They have families. They're out there distributing food, masks, advocating every day. When I see our sheriff who's out there and all of his folks who are every day putting their lives on the line for us. So thank you to ABC13 for hosting this. And as mentioned, let us continue to do this and even just work within our cluster. You don't have to be an elected official. You don't have to be a CEO. Work within your family and have these conversations, because we see way too many people, especially in the light of social media, out there doing things that are very dangerous. And you're not just endangering yourself, but some of the people you love the most will die if we're not careful.
Yeah, great points there. Now, we talked about the comorbidities as well now, and also the cycle of poverty. So city and county leaders, of course, continue to encourage the community to go out there, get help, go to the hospital if you don't feel well. We say that often. But the community is afraid of getting stuck with that high bill if they do get hospitalized. That's always in the back of their mind, that they can't afford it. And sadly, some are dying at home, unfortunately, because of this. So this should not be happening. Where are the resources to help them with that bill at the end of the day once they're well and released? Congresswoman Garcia, I want to start with you.
Well, we're trying to make sure that we provide the resources up front. It's always been about testing, tracing, and the treatment to make sure that it's all free. And that it's all no questions asked whether or not you have immigration status. Now that's really hard to do sometimes when the testing are not as robust as they should be to make sure that we have them all over. Now we are also looking at making sure that we can look at some of those bills, but a lot of that really goes to whether or not the person has insurance. You know, this state of Texas does not have an exchange under the Affordable Care Act. We have not expanded Medicaid. So it makes it really, really hard for people. I know that in my district, it's over like 1/3 of the people have no insurance. So what they need to do is try to go to the FQHCs, the federally qualified health clinics, the community health centers, or to any of the Harris Health systems, because those are the systems that will work with them, and many of them will not charge, or they will charge on a sliding scale fee basis. So if you don't make a lot of money, then they're not going to expect a lot. So that's what I would encourage people to do, and to make sure that they apply for the benefits that they're entitled to. I know we still have a reluctance, if you will, to seek help. But whether you were a veteran, whether you paid your Social Security, whether your child is enrolled in the CHIP program, those are all things and resources that you should be making sure that you take advantage of now, because those bills can happen. Now, I know that one of my colleagues even has a bill to try to make sure that we can cover funeral expenses, because when you end up with a hospital bill that you can't pay, and then with a death that you weren't expecting, then it becomes even more problems. And that, I'm a co-sponsor of that bill, and we hope to be able to get some relief for those families that don't live like in, Harris County has a paupers a cemetery. We have a paupers program, but it needs to do more. It's heartbreaking. It's heartbreaking to see that in the Valley, they've had to get refrigerated trucks because they can't keep up with the deaths. I spoke to a funeral home director just yesterday about another matter, and he was telling me that he's getting 1 to 2 COVID-related deaths a day, and that it is just truly sad because people are just not prepared. So we got to look at all of it, and to me, it starts with passing again the HEROES Act, because that covers a lot of what we're talking about. We just need to put more pressure on our senators. If you want the unemployment benefits, the $600 supplement extended, if you want to make sure that you get another stimulus check, if you want to make sure that we get help for all the frontline workers out there, if you want to make sure that local governments get money, we've got to put the pressure on Republicans and our senators to make sure that they listen and that they do what they can for people and working families to make sure that A, that they can remain healthy, and B, that they can survive during this pandemic.
Thank you. Representative Wally, what efforts do you expect to see when the 87th Texas legislature convenes in January in regards to this?
Well, you'll see. Look, we're the state of Texas. I'm a member of the Appropriations Committee, have been for the last 4 sessions, and I got to sit on the conference committee that actually crafted the $250 billion biennial budget that we passed every 2 years. And so this coming session is going to be a challenging session, particularly because most of our budget is based on sales tax revenue. That's how we generate. We're a consumption, just like most of the country. 70% of our economy is based on consumer spending. And in Texas, that's very important, because the more that the middle class spends money, the more that we generate revenue at the state. And so what happens, according to our budget revenue estimate, our comptroller had to adjust our budget prognosis or our budget revenue for the next biennium to about 3 to 4. In some instances, we'll probably be in about a $7 billion hole. And so one of the things that we can do is we have what they call the Economic Stabilization Fund, which is called the ESF. It's a rainy day fund. By the time we get to session, we will have probably roughly about $8 to $9 billion in that rainy day fund. I'm a big proponent of utilizing that rainy day fund to and use it for its intended purpose, particularly to plug holes in our state budget. Our biggest cost driver in the state of Texas in our budget is education and healthcare. They drive our budget. Those are our 2 biggest expenditures at the state level. And so I'm going to be a big proponent of tapping that rainy day fund. But also, look, the state of Texas right now, as we speak, is holding on to they received about $8 billion in CARES Act money. Right now, they've spent the governor's office has spent about $1 billion of that. So there's about roughly $6 to $7 billion left in the CARES Act, federal CARES Act money that's going to be at some point utilized. And so our fear is that they're going to use that money to supplant state revenue for some things that might work, but by and large, when we had a rescue bill during the Obama administration, my first term in office, the state of Texas took $12 to $14 billion in federal money, and we ended up supplanting state revenue with those federal dollars. And what I fear in the next coming session is that we are going to do the same in supplanting those state dollars with federal dollars, when we could actually do a lot better in utilizing a rainy day fund, because we also let's be honest here. Every session that we come into the legislature, we already are in a $2 billion hole, because what we do is we write an IOU for Medicaid payment. So every session, the years that I've been in the legislature, the last decade, we always come in and we have to pass what they call a supplemental bill. And that supplemental bill pays for Medicaid, because we back pay it we have to pay that bill for the previous 2 years. And so my push will be to use a rainy day fund, but also that the best way that we can get our economy back to some resemblance of recovery is that we use masks, that we use social distancing, that we get tested, that we continue to wash our hands, because that's the best way that we can do those tools. We can utilize those tools now. We have agency. We can do that now to be able to get us back to a smoother recovery. And unfortunately, I'll be frank with you, it's going to be a rough session this coming session, because let alone will we be dealing with our budget crisis, we also have a redistricting year coming as well. And so there are going to be a lot of challenges coming up, but a lot of us that have been serving the last decade, we're up to the challenge, and we're going to continue to fight for folks here in Harris County, but for all Texans that right now are suffering. And look, Missouri, yesterday or a couple of days ago, passed a referendum to expand Medicaid by 50+% of the vote. There's no reason why Texas does not expand Medicaid, because we are losing federal dollars when we do that. For every $10, 9 out of those $10 that we spend on Medicaid, 9 out of that $10 is reimbursed by the federal government. That's a wonderful match and money that's being left on the table that's going to other states to expand their Medicaid. So, for instance, Missouri is going to expand Medicaid. Texas, unfortunately, is going to, over the last 10 years, is going to be losing money. And what we can do is put more people to have a medical home. Get these folks who might have COVID to have a medical home to see a doctor. And so there will be some challenges, but we're going to continue to fight for those folks here back home in Houston and in Harris County for those dollars.
Yeah, and we really do need the help here. I want to go to a viewer question here. So Luis from Pearland, he was asking, why are some hospital treatments different from others? My mom is on a ventilator and has received 1 dose of plasma, when I have heard of others getting 3 doses of plasma at other hospitals. She was also given remdesivir, if I pronounced that correctly. It did not work. I am a COVID survivor, he said, and it worked fine for me. Also, I read that some patients are given hydrochloroquine and it worked. Over the weekend, the program RLF-100 from Nevrox was given to a patient at Methodist Hospital and it worked. How can other hospitals get that help that patients are badly ill that need? And can that probably help? Dr. Varon, can you chime in here on this?
Absolutely. I mean, and that's a fantastic question. The question is, what do we do? First of all, let me just echo very briefly on what Sheriff Garcia said, and also what Sheriff Gonzalez says and what Congresswoman Garcia said. This is an illness that is a backstabber. It's an illness that kills people. It's an illness that we need to address. And you can have all the treatments in the world that you want, but if you get to the hospital late, it is too late. That's why things like testing are the most important of what we can do. With regards to treatment, so that you know, there is not one treatment that is good for everybody. We have by far the best success rate in the Houston metropolitan area at United Memorial Medical Center. We have a treatment that is called Math Plus, which includes a couple of things that aim towards treating the ill effects of COVID. What that means is COVID kills you by 2 mechanisms. Mechanism number 1, inflammation. Mechanism number 2, a lot of clotting. So what we do on the Math Plus protocol, M is methylprednisolone, that's a cortisone-like agent, a steroid, that decreases inflammation. A is ascorbic acid, vitamin C, and if you remember when you were a kid, every time you got sick, abuelita would give you vitamin C because that was good, so this goes along. T is for thiamine, which is another vitamin, and H is for heparin, a blood thinner. So what we do with that is we attack whatever the virus does. Because the reason why COVID kills you is not, you can give all the antivirals in the world, but if the virus already caused a lot of damage in your body, you have issues. Every hospital has different protocols. We use this one because we created it among other 5 people in the nation, and we're doing fantastic. But you need to understand that there is no magic treatment. Plasmapheresis was used, the use of plasma, a lot of people were using it. Now there are studies out there saying that maybe it's not as good. Hydroxychloroquine, that's the drug that has been politicized up to the wazoo. I've used it, it works for my patients, but what happens is we give a lot of them, a lot of things that at the end of the day you don't know. This new medication that the people at Methodist use, very encouraging. But in order to tell you that something works, you have to do huge studies. And at the present time, we don't have time for those studies. We're working against an invisible enemy. So we are basically throwing the kitchen sink at them. And how we do that depends from hospital to hospital. Whether they gave you remdesivir, whether they gave you some other agent, depends on what's available. That's the other thing. Some of these medications are very difficult to find. You cannot get all the stuff at the same time on every hospital. And to be honest with you, doctors are their worst own enemies. We are very different. We don't like to do things all together. If we were to have a single unified voice with a single unified treatment, we probably would be doing better, but at the present time, we're not. In Houston, you have fantastic hospitals in the med center, in the periphery. Everybody's really trying to work hard and do our very best to save as many lives as we can. But more importantly, if we can identify who has the virus early by testing, you are much better off than going to the hospital late and then, we breaking our heads deciding, should we do remdesivir, should you do the plasma, should you do anything else? Like I said, what we're using seems to work, but we need to disseminate that information, and that takes time.
Yeah. And I think everyone's looking for that quick answer, that quick fix. But I think the main thing here, if people are watching right now, is the moment you feel sick, the moment you feel something, go
Absolutely.
Get tested, go to the doctor, because like you said, that inflammation, especially if you're dealing with diabetes and heart disease, that's what's going to get you if you're waiting too long to see, let me see if I just get sick, or it may just be, allergies.
Or or even worse than that, my primary concern is, everybody's waiting for the magic vaccine to come in. Mm-hmm. And, let me just tell people, don't wait for it. It's not going to be here anytime soon. Because once you produce it, you have to distribute it. Once you distribute it, you got to convince people to get it. And if we don't get, and this is very common among Hispanics, they don't like to get the flu shot. Do you think they're going to get the corona shot? Let's just be clear. That's not going to happen anytime soon. So the best thing is just do your things, social distance, wear your mask, wash your hands, and get tested. That will help us as a community to control the spread of this catastrophic illness.
Yeah, I think it's like we have to keep pushing that, because sometimes our Latino community, Hispanic community, no escuchan, they don't listen, right? They're kind of stubborn sometimes. And I know I've had to say this to my parents over and over several times. Get tested, wash your hands, do this, do that. Another viewer question here, this one's from Gabriel, and it sort of ties it into everything we've been talking about. He says, because Hispanics or Latinos do not communicate as much through Twitter, Facebook, why do we not make a better effort to conduct better education to avoid COVID-19? He talks about foot soldier work to really get out there with flyers, booths, health representatives in locales such as Hispanic markets, apartment complexes. We've heard that a lot. And we know Mayor Sylvester Turner, he had the Todos Juntos Mejor recently, everybody better together, to try to really hone in on this message. Susie, let's talk about that. How important is it to really just keep emphasizing and end up in those communities where, Latinos, Hispanics really need to hear it over and over and over again?
Yes, I think they need to hear it over and over and over again, and they need to really spread the message amongst themselves. One thing that I am actually personally dealing with being a COVID caretaker at the moment. I have both my parents who tested positive last week, and we're in the thick of it. Thankfully, my mom is home. My dad is still hospitalized. But one thing I had to come to quickly learn was, how do you react as a caretaker? So I know a lot of these families are in situations where somebody is taking care of them. And how do they protect themselves to stop that spread? And I think if they have information about how to build their immunities, the vitamin C, the zinc, and the things that you can do to help prevent, in addition to the masks. So I think the grassroots efforts would really help, because I think, like you said, during newscasts, that's when most people are at work. They're working 12, 14 hours a day. And by the time they get home, the last thing they have time for is to sit down and watch the news and find out what's going on. So getting information to them, I think we do have to try different efforts, different avenues, even through the drive-through pickups, people are getting the handouts and getting the information, but they're not really being discussed. They're just grabbing and going. So maybe finding ways where at these sites, they have an area where people can pull up and get more information, get their questions answered, getting the information. The website is really helpful, Todos Juntos. It helps them.
Yeah. And I think that's right. It's like having maybe like a drive-through to give away food, but at the same time have that conversation. Hey, just a reminder, wash your hands. You know that, right? Lavarse las manos, la distancia de 6 pies, something that we definitely have to keep honing in on. Is the feeling that I'm getting here. The community just needs to hear it over and over again from different avenues.
Sure. Or even how to keep your kids, helping them to social distance, teaching them that it's important for them to do it as well. Because like the Congresswoman said, this is impacting children. They can help spread this if they're not being careful.
Yeah, definitely. I want to touch
Myra,
on...
Can I add to that?
Of course, yeah, chime in here.
Yeah, I just wanted to thank the caller for that question, but I think it's important to remember that to do health fairs, to do flyers, it's really difficult right now when we're such a hot spot. Mm-hmm. And, we can't get out there. We really do need to stay at home. So the best that we can do, unfortunately, is doing virtual events like this. So I think the more town hall meetings like this that we can do, and I know we've had probably 8 to 10 the first round. We've done radio ads on Spanish speaking radio. We've done texting. We've done emailing. We've been mailing. But again, I'm limited to just doing those sort of things in my district. But hopefully, I'm trying to work on a project where we can expand that beyond this, because I think he's absolutely right. It's an educational process. It's like you said earlier. Some people wear their mask and wear it on their chin or put it underneath their nose. And it may be that they don't know how they're supposed to wear it. Some of them don't have it, and then they don't know how to wear it. So it's an educational process, and unfortunately, we're coming in at this, 4 to 5 months later. But better late than never, because it is about the lives of many, many people. Again, we're almost 50% of the deaths in Texas. That is not a record to be proud of. We've got to do better, and we've got to make sure that we can get the word out so that we can save more lives, because, the future of us as a Latino community is at stake.
Yeah, might I add that the Houston Hispanic Chamber of Commerce has, for the last 15 years, had a program in English and in Spanish on radio, on television, where we are talking to these families, because for many of them, unfortunately, computer access they don't have. Many of them do not speak English. And so one of the forms of communicating with them is through radio and television in English and in Spanish at all times. And so we're very grateful that we have those media platforms, because we have an audience reach of over 3 million. That's just one way, but we just need to continue to have these conversations and to have them at different times of the day. Yeah. People can easily have access to them. And we're looking to our corporate partners in this philanthropic community, for them to continue to step up, to make sure that we help those who don't have the resources, those small nonprofits who are doing the work of the Lord by helping those who have no other resource but that small church, that very small nonprofit, is to funnel monies to those nonprofits because they are the ones there every day. And the people who live in those communities, that's where they go first. So let's continue to put money in the hands of those small nonprofits.
Yeah, you're right.
Might I have some some quick information on that? Just being that I Judge Lena Hidalgo appointed me as a recovery czar, and so one of the things that we did early on, both health departments have committees, Latino or ethnic task force within their health departments. So Dr. Shaw and Dr. Perez at the Harris County Hospital, Harris County Department of Health, and Dr. Steve Williams. Steve Williams and Dr. Peirce both have been coordinating together to reach out as the question is a great question as far as getting boots on the ground. And so right now, what you've seen, particularly in that Gulfton area, Southwest Houston, where there's a high concentration of apartments, you've had people leave door hangers in English and Spanish. That exact information that you're talking about why it's important to social distance, giving you information and empowering you on how to get tested and what you need to do. And at the county level, they're hiring promotoras. They've hired promotoras to go into communities. So last weekend, the last 2 weekends, myself, we went to the Pulga on Airline Drive.
That's a great place to go, yeah.
Hundreds of leaflets and masks, and myself and the health department the last 2 weekends have gone out there to give masks away, to give leaflets away, to say, hey, look, this is the information that you need. And so right now, a lot of the TMC, the county is putting forth $1 million media buy for particularly for the Latino community and communities of color. So the county also is putting resources using their CARES Act money to actually reach these communities. The commissioner's court is with Commissioner Garcia passed I think $1 million item to buy masks and distribute those to nonprofits so that the nonprofits are able to distribute those masks into our communities. And so there's a huge effort. The Texas Medical Center, most of the institutions at the TMC are spending ad dollars. Part of their ad budgets, as Dr. Murillo mentioned, they're going to Latino communities. I don't want to single anyone out because then the other one will get upset. Others will get upset. But there are certain TMC institutions that are putting money into radio, into digital information ads. So there's just a huge effort on everybody's part right now, from faith leaders to local government to foundations. A lot of our Houston foundations are also putting resources into this effort. We lead a nonprofit organization, not organization, but a roundtable of the nonprofits to figure out, okay, where do we need to be? Obviously, the faith-based community is a huge part of that. And so just know, I want the viewers to know, and that's a great question, because it's not just digital divides is a huge issue, but it's just not, that Facebook post or that Twitter or that Instagram post that's important. Those are very, very important, but actually getting boots on the ground and knocking on people's doors. And that's what both the city and the county have both been doing for the last month, over a month now.
Yeah, and I think, we know that the effort is there and everybody's really, really trying hard, but I think this is going to be something to learn from and obviously continue to educate the Hispanic community. So I want to highlight tonight some racial disparities because I know we're getting close to our time here. I want to make sure people know this. Racial disparities among children of color. So a study from Washington, D.C. shows that 46% of Hispanic children tested higher for the virus compared to black and white children. And then last night, ABC News obtained an internal memo from FEMA with data showing that a disproportionate number of non-white children are dying in the U.S. from COVID-19. Nationwide, of the people under the age of 18 diagnosed from March the 1st through August the 3rd, 40% were Hispanic, 34% were white, and 19% were black. So the ethnicity breakdown for those patients who died from the disease as well is 38% Hispanic, 34% Black, 25% white, and that's according to the memo. So we're obviously seeing, this trend everywhere, which is not anything to be proud of, as you guys were mentioning, not something we want to say we have these high numbers for. Dr. Baron, is this also because what we've been talking about, you have all these multi-generational families in one house that we're seeing this?
Absolutely, without question about it. All these multi-generation, and again, just like Sheriff Gonzalez said, this is cultural. I mean, we like to live together. We like the carne asada. We like that closeness. That's what makes it. I actually, I'm getting hungry. I mean, I'm feeling like a carne asada. and all of us, I tell you, if I was to tell you, all of you guys, to come and join me in my home, I mean, you would probably want to come and have a carne asada, because that's who we are. And that's what we need to work as a team, to try to convince people that for a short period of time, we need to be different. We need to stay away. We need to keep our social distance. We need to stay home. And we need to stay home as distant as we can, one from the other, because, out of 140,000 people that we have tested at our hospital and locations, about 20% are positive. And of those 20%, 48% are asymptomatic. And I'm telling you, I feel more comfortable going into my COVID unit where I know who has COVID than going to the supermarket where I have no idea who has or who doesn't have COVID. So again, I mean, the Latino community is so warm, so next to each other. Let's do something right, and let's try to prevent this from spreading.
Yeah, you're right. So it looks like we're almost out of time here, but of course I want to, go around to everyone here before we close, and just any specific message that you guys have for the community, any solutions you think came out of this tonight. If you guys want to start, Sheriff Garcia, we'll begin with you.
Thank you, Mayra, once again. And again, I think it's important that we remain optimistic. We can overcome this. Our community can overcome this. It's going to require a lot of pivoting and changing. There's tremendous challenges. We know many of our children are going to be returning to school. There's a digital divide, concern about that. We know the health disparities. Also, when a loved one is hospitalized, be prepared, because you're not going to be able to be by their bedside. That's going to stop. You're lucky if you have any contact via some type of video conferencing maybe. So you're going to be apart from your loved one. That's going to be tremendously difficult. We're seeing high numbers of deaths and illness. Dr. Baron just mentioned about the dangers of even sometimes going into a supermarket, a crowded condition. Well, who's working at those locations? It's likely to be Latinos, Hispanos that are working there, delivering that food, picking up the crops and everything. It's Latinos that are going to be impacted. So we must really think of how we operate, how we continue to move forward. We will overcome. We will do well. We have great leadership. Many of the fellow panelists here, Congresswoman Garcia, Wally, our recovery czar, the business committee, Dr. Murillo, Dr. Baron, Susie, so many other people. And just we need to stay together. We need to remain prayerful. We can overcome this. It's going to take work, but let's be smart. Let's heed the warnings. Pongan atención, pay attention. Please, we know it's challenging. You don't want to lose your job. Many times you depend on that job and you don't have sick leave. You don't want to disappoint, your patron, your boss. But this is about life and death. It truly is a matter of life and death. I know personally from my own experience and experiencing the loss of loved ones. And so we really need to step forward and lead at this moment.
Yeah, you're right. And I want to apologize because I just realized that I called you Sheriff Garcia. I meant to say Sheriff.
It happens often.
Yeah, Representative Garcia, you're next.
Thank you again, Myra, for having us tonight. And all I have to say is something very simple. Houston, we have a problem. Houston, tenemos un problema. But working together, I know that we can fight this and win. We've weathered many storms. We're used to that. But this is a bigger storm that we've never faced before. We've got to listen to the doctors. We've got to listen to the experts and do what they tell us to do. Each one of us can do our part. And it starts with wearing your mask. It starts with washing your hands. It starts with you making sure that you social distance if you have to get out. But stay at home, go out only if you absolutely have to, because the numbers are really horrifying when you think of the number of Latinos that are dying every day in Texas and across the nation. So please, wear your mask, ponga su mascarilla, make sure that you do your part. Working together, I know that all these leaders that I've been on the program with tonight are working hard, working together to make sure that we can keep you healthy and that we can keep you safe. And let's be sure to wear that mask. Thank you and God bless.
Congresswoman Garcia, thank you so much for that. Representative Wally, you're next.
Well, thank you, Maida, for the invitation to participate with this panel, and many good friends, family friends here, Congresswoman Garcia, Sheriff Gonzalez, Susie Molina, good friend from high school, Dr. Murillo, Dr. Baron, and so a great panel, and just honored to be part of this effort. Look, I want to thank the public for their hard work. Many of our brothers and sisters, our abuelos and our tios and tias that are going through some tough times right now. Look, don't be, just because we can't go to the carne asada, please don't get upset with us. That we can't go to the carne asada, as Dr. Baron was mentioning, because we do it out of love. It comes from a position of love to be able to social distance. It comes from a position of love to wear a mask. It comes from a position of love to continue to wash your hands and tell your children to wash their hands, and practice those healthy techniques. And so for us, as a community, my wife, Debbie, my two boys, Mandito and Joaquin, it's been a challenge. I'll be honest with you. It's been a challenge even for our family. Because, we're again going to start school here in the next week or two, virtually. We know the digital divide is going to be a big issue. We're working on that with TEA to get more than $200 million in funding for TEA for devices and hotspots for our community. But also, we also have to think about our mental health. So that's one plug I want to be able to convey to the public, that take care of yourself, go for a walk, make sure you wear your mask when you go for a walk. But you got to take care of yourself mentally as well, because it is challenging. It is something that challenges all of us. But just know that your county leadership, Judge Lena Hidalgo, Commissioner's Court, Commissioner Garcia, Commissioner Ellis, Cagle, and Raddick, and the mayor, and they're working extremely hard. We work together. Marvin Odom and myself didn't know Marvin, my counterpart at the city. Didn't know him well before that. We've gotten to know each other very well. We're pretty much close to lockstep in responding to a public health crisis, right? But as best as we're trying to respond to the pandemic and saving lives, we also have to save livelihoods. And so I would just say, con mucho ánimo a nuestra gente, los admiro mucho. Nosotros podemos vencer a este virus. We know the tools. We have agency. We have to empower ourselves. And I just want to say thank you to our panelists. Thank you, Maida, for the opportunity. And thank you to the viewers for listening. And again, if you don't get anything else, call 832-927-7575 to get tested. Please, 832-927-7575. Muchísimas gracias y un beso a todos.
Thank you. And Dr. Murillo?
That's one show and tell. When we say wear your mask, cover your nose, cover your mouth. Houston, we can do this.
Tápense la boca. That's what we need to do. All right. That was great. Thank you. Susie?
I just want to say thank you again for having me on this panel, and to all the other panelists for a great job. And we really do need to do our part to inform the community. I think in terms from the mayor's office, we encourage you to visit HoustonEmergency.org. That is a website that is in Spanish. It can translate. Please share that with your family members. Let them know they can read all the information in Spanish. and English and other languages. It's HoustonEmergency.org. And that gives you a lot of vital information on what to do. And we just really need to encourage our family members that they have the power to really control the spread and do the things and take the steps and be proactive. And it's not just for right now, it's for later on. We don't know what this virus is going to do in 10, 20 years for people who've had it. So just think about the long-term effects. Think about your children. Really, as we are a community that really loves and embraces each other, and we love the pachangas, and we love the quinceañeras, and we love the parties, and we really need to just emphasize that, we want to be here for the long run. We want to be here to see those milestones, and so we have the power to really help control the spread. So again, visit HoustonEmergency.org. There's a lot of information on there. It's in Spanish. Tell all of the comadres about it so that they can tell everybody else. We know that comadres are really good about spreading the information.
Yeah, they'll listen to a comadre before they listen to the doctor. And with that, sorry, Dr. Baron, but you're next.
Absolutely. I mean, there is no question about it. They actually will give you the treatment plan, which is much better than the doctor's plan. So, but let's get a little serious. This is not a hoax. I lost a patient today. The last 3 weeks, I have signed more death certificates than in my entire career as an intensive care doctor. This is real. I can tell you that most of those death certificates were for Latinos. Latinos that came to the hospital very late. Latinos that had comorbidities. But more importantly, Latinos that did not listen to what we are all trying to say. So for goodness sake, people, keep social distance, wear your mask, wash your hands, and if you can stay at home, stay at home. We have, as a society, have been through a lot of different nasty pandemics throughout, different centuries, and we always prevail. How long it takes us to get there depends primarily on us. And as Hispanics, we're getting hit by this illness. Let's fight it. The only way to fight it is to kind of mellow it down. That's my little message. And for all the members of the panel, once this is over, I promise to have a huge carne asada at my home.
There you go. You already said it. We're all there. Okay.
And all our family members.
And make sure you're going to expect 10 family members per invite.
There we go.
Thank you so much for everyone that was here to talk about this. So as we highlighted tonight, our Hispanic and Latinx community continues to be hit really hard by this pandemic. The Hispanic community is a unique population that has yet to be understood by some. How can we, as leaders of this city, connect with them and help them if some of us don't recognize their needs? Now, Hispanics in Houston make up 44.8% of the population. In the U.S., currently, there are 57 million, and that is projected to grow to nearly 85 million by 2035, which is why this was very important to have tonight. So I hope that tonight's town hall has been educational and will help us to continue bridging any gaps in our community. And I know there are so many efforts already underway by many of you, and we appreciate that. Thank you so much. Gracias a todos. Cuídense. Pónganse su máscara. Lávense las manos. Y por favor, distancia.